DNA's podcast series, Let's Talk About Kidneys, provides education dedicated to exploring the journey of those living with chronic kidney disease. We're here to inspire meaningful conversations and to help people living with CKD gain a better understanding of their disease. Hello, everyone. Thank you for joining us. Today's podcast topic is kidney disease, from diagnosis, staging, and common tests. Have you ever wondered how a patient is diagnosed with kidney disease? How do they know what stage their disease is in? And what are the most common tests that a kidney patient has to undergo during their healthcare journey? Today, we explore this topic in more detail with Dr. Lauren McDonald, a nephrologist with Dallas Nephrology Associates. Dr. Lauren McDonald joined Dallas Nephrology in 1988. Dr. McDonald is a board-certified internal medicine and nephrologist. Dr. McDonald currently sees patients at our Dallas Landry and our DeSoto Charlton offices. Dr. McDonald is also responsible for DNA's skilled nursing facility and long-term acute care programs. She is also a national advisor for the Black Kidney Awareness Resource and Links Incorporated. Thank you, Dr. McDonald, for joining us. We're just honored to have you here and share your knowledge. So
thank you.
I'm going to jump right in and we'll get going with some questions. Okay. All right. So what test is used to check for kidney disease? Let's start with the very basics.
Well, basically, if you go to your primary care doctor, they're going to draw blood. When they look at the blood for kidney disease, they're going to look at two numbers. Mm-hmm. One is the BUN, or it stands for blood urea nitrogen. The other is the creatinine. And we look at those two numbers and it kind of tells us whether something is abnormal. Most ladies, that number should be 1.0 or less. Men, generally 1.2 or less. Okay. So that's kind of how we get started. The other side of it too, to look at the function of the kidneys, because a lot of times people will say, hey, I'm making urine. What's the big deal? Who cares? I'm making urine. Well, the other side is that when you eat, you metabolize the food, your body does. The waste comes out in the stool or the urine. So if your kidneys aren't working well, those two numbers that I mentioned become abnormal. We also like to look at urinary protein. If there's an excessive amount of protein being spilled, that will tell us that there could be a problem. Sometimes at the doctor, they'll go ahead and you leave a specimen, they'll check for the urine, they'll tell you what's going on. But generally, as kidney doctors, if we're able to, we like to do a 24-hour collection, gives us real precise information.
Okay. And so say that a person hasn't had these tests done. Is there something that they're going to notice physically in their urine, or is this mostly found through these specific tests?
Well, you mentioned urine, and that's always a good part of it, because sometimes when people have certain diseases like diabetes, sometimes autoimmune diseases like lupus, they will spill a lot of protein in the urine. So what happens is when you look at the toilet bowl, you see foam. It almost looks like a head of beer. And that tells us as kidney doctors, there's something wrong. You're spilling a lot of protein. So we like to pay attention to the urine. Again, if it looks like there's blood, if it's pink colored, or even Coca-Cola colored, that tells us that there's something going wrong that needs to be investigated.
Okay. So are there any additional screening tests that have to be done for patients that are diabetic or patients that have hypertension?
Well, generally, if you are diabetic, it's important that you get a blood test drawn called a Hemoglobin A1C. Mm-hmm. Now, back in the old days, before we had that, diabetic patients would eat properly, they'd come to the doctor, everything looked wonderful, and then go home and start eating all the things they're not supposed to eat. Well, the A1C, the hemoglobin A1C, is a special type of test, and it tells us what the blood sugars have been for as far back as 4 to 6 weeks.
Wow, that's a long time.
So if you've been good, and generally being good is a number between 6 and 6.5, we know. But if you haven't been good, that number, the highest I've heard, has been from 12 to 15.
Wow.
That way we know you need to do something about your diabetes. So that's an additional screening test. With people with blood pressure, again, that urinary protein is important. It's also important if you have high blood pressure or hypertension, We like to know what those numbers have been. A lot of times people come to the doctor, and I always tease my patients. I'll say, I might have like one eye in my forehead, and you're going to look at me and panic, and your blood pressure goes up.
Right.
So it's really nice for us to have an idea of what your blood pressures are like in the morning, in the afternoon, in the evening. I would never look at one kind of borderline blood pressure and pronounce somebody as being hypertensive. It's a series of readings we like to look at.
Okay. So, and those people can have those readings done at home, not
They
just
can
at the
check their
office.
blood pressures
Okay.
at home. And I always tell people, if you have your device at home, bring it with you to the doctor's office. That way we can always check to see, are your numbers the same as what we're getting to make sure it's accurate.
Okay. And then what test determines the actual stage of someone's kidney disease?
Well, staging of kidney disease has been around maybe 10 to 15 years, and it's relatively new. And so we know stage kind of tells us how well the kidneys are functioning. And there's a fancy term for that called the GFR. When you get your labs from your doctor, you're going to see something that says eGFR. The E stands for estimate. GFR means glomerular filtration rate. And I know some people are saying, what is that?
Yeah.
Okay.
And you're going to break it down.
Let's
for
break
them.
it down. Let's put it where the goats can get it.
Yes.
Okay. And the glomerulus is kind of like the workhorse of the kidney, composed of blood vessels and specialized cells within the kidney. And what happens is the blood flows through and it's filtered, and that rate is very important. Basically, the estimated rate tells us how well or how poorly your kidneys are functioning. So generally, stages 1 and 2 are pretty mild. Normal kidneys, generally, we say 120%. We do that to make it easy for people to understand. Really, it's 120 cc's per minute. And then going down from there, like I said, that's stage 1. Stage 2 is also mild. Stage 3 is considered moderate kidney disease. Stage 4 is advanced or severe. Stage 5 is when you're almost ready for dialysis. So I'm not going to bore you with the numbers at each stage, but just understand at stage 3, that can be moderate. Stage 4 is severe. That's when we know you've got kidney disease. We need to start thinking about, will you need dialysis? What about transplant? We need to start educating you about kidneys. And when your kidney function is 20% or less, that's when you and your nephrologist will talk about the possibility of applying for a transplant.
Okay. So let's back up a little bit. And can you describe the transition from stage to stage? Is it something that is captured on a test? Is it a feeling that patients will have? Just explain that transition from stage to stage.
Well, generally, I'll say kidney disease is usually pretty painless or asymptomatic. So generally, there's nothing that's going to tell you that you're advancing from a 2 to a 3 or a 3 to a 4. We look at the numbers. And so, like I said, there's no real marker other than your laboratories that's going to tell you. Now, the most common cause of kidney disease in this country is diabetes and hypertension. As you progress, and let's say you don't take good care of your kidneys, you could progress from stage to stage to stage. There's several things that we do and medications that we use to try to forestall the progression of your kidney disease. Sometimes they're successful, sometimes they're not. Generally, with blood pressure, we like to make sure those blood pressures are well controlled to prevent you from worsening your stage of kidney disease. In the old days, I used to say any blood pressure 140/90 or less is good. These days, we're more keyed into 120/60 to 70 because we've seen with studies that if we have well-controlled blood pressures, there's less of a chance of developing cardiovascular disease in the future.
Okay. And so you discussed a little while ago that there aren't any symptoms, but is there anything a patient can identify or relate to being
Sure,
in a kidney
yeah.
disease stage?
Well, sometimes what will happen as your disease progresses, people might notice some swelling. Their ankles might swell, their fingers might swell. It may be hard to get their rings on. That might be one of the first signs that your kidneys aren't getting rid of that extra fluid that we talked about, that you're retaining fluid. So that's kind of a subtle sign. Sometimes as you go further with this, people might find that they have a loss of appetite. And that's because the poisons build up in your body and suppress a lot of functions. But we'll see appetites aren't good. And then as it progresses, people might even say, I have this funny taste in my mouth. Mm-hmm. And what we call uremic, and uremic really means kidney failure. But that uremic taste, that metallic taste, will tell you that something is wrong. Sometimes the simple act of putting toothpaste on your toothbrush and putting it in your mouth can make you vomit with advanced kidney disease.
Wow.
So if you have those symptoms, if you have weight loss, your appetite is poor, it's always important to let your doctor know.
Okay. And I think the swelling is something that we can kind of touch on for anyone that's listening, because I know a lot of people feel, oh, I'm on my feet all day. I wear heels, or, a gentleman wearing, business shoes, but it could be more than that. Just basic swelling is what you're saying.
Definitely. Yeah. We all experience some swelling, particularly when it's really hot outside. If we've been on a plane or a long car ride, we're wearing extra high heels that we all like to wear. You're going to see some swelling. You might see where the straps have contacted your foot. But this is more than that. This is persistent swelling. Okay. It may not even go back to normal when you go to bed at night and you wake up in the morning, you might still see some swelling. So it's important for you to notice those things and let your doctor know.
Okay, good. Can you explain to us the difference between acute and chronic kidney disease? We hear chronic all the time, but explain the differences between those two, please.
And that's a really good question. Basically, acute means that it's happened almost instantaneously. It's happening right now, so to speak. Chronic means it's been going on for a while. And one of the studies, for instance, let's say you go to your doctor, your kidney function, that creatinine number that I mentioned is elevated. One of the tests that we might get is something called a sonogram. A sonogram is a picture of your kidneys using sound waves. And I'll mention later why that's important. So we can see, you can imagine if those kidneys are small and shrunken, it tells us that whatever's going on has been going on for a while, hence it's chronic. If we do the sonogram, those kidneys look normal size, most likely it's happened pretty recently, or even sometimes so diabetics with long-term disease can have normal sized kidneys. But acute or chronic is important to know. I've had patients that have come in with an abnormal creatinine. In fact, I had one case that really sticks with me. It was a young lady. She was about 15, 16, had recently got her menstrual period. Her mom was just giving her lots of Motrin, which is ibuprofen, which is Advil, similar to Aleve, which is longer lasting, which is naproxen. And as a result, she had acute kidney failure. She'd been normal. She was taking these medicines. She was suffering from cramping. Her creatinine was very elevated. We had to put her on dialysis for about 2 weeks. She recovered function. So that was a great example of acute kidney function related to a medication.
Okay.
Whereas we have patients with long-term disease like diabetes, hypertension, lupus, going on for years and years, that's chronic.
Right. All right. Yeah. So that was definitely, as you know, my case, that was definitely the case for me. The chronic hypertension, not being able to control it, trying different medications. So I can throw that example out there as something that a patient can experience in the chronic stage. Are there any other tests that a patient has to undergo throughout this journey?
Well, a lot of times what happens is, as I mentioned, the common types of kidney disease in this country usually related to diabetes or hypertension. So we kind of have an idea of what's going on. Sometimes we'll see patients where the kidney function is abnormal, they're spilling protein. We're not really sure why. Mm-hmm. It's not like someone has symptoms consistent with something like lupus, like joint aching, hair loss. We're not sure why, so we will do a kidney biopsy. And a biopsy is actually just a day surgery type procedure The radiologist uses something called a biopsy gun, which is a terrible term, but you will get several specimens of small kidney tissue. It goes to the pathologist. The pathologist looks at it under the microscope, and also a specialized electron microscope, which is a really up-close picture, which is great. And that gives us a great idea of what's causing your kidney disease. Once we know what's causing it, it should help us treat it.
Okay. So I'd like to kind of touch back on what we discussed in the beginning, so that if anyone that's listening, if they have not have been told already that they have issues, if they're going to a primary care for their annual physical, what tests can a patient that is seeing their primary care physician, what's the name of that test they can ask for to have done to check for their kidney functioning?
You really want to ask your doctor, did you check my creatinine? Did you check my urinary protein?
Okay.
And I always tell patients you have to advocate for yourselves.
Yes.
You know, no one can do that for you unless your mom is there. But if your mom's not there, you better
And
advocate.
if your mom's not educated on what to advocate
This is true.
for. Yes.
This is true. The other thing I want to mention that's important when we talk about abnormal kidney function, get a little read on your family history. A lot of times culturally, people don't like to talk about the health problems of their ancestors or the previous generation. But it's important to know, because if you present with an illness, particularly kidney disease, it's important to know if your father's brother died from kidney disease, if your grandmother had kidney disease. That's very important for us to know. And also, if you have a first-degree relative that had kidney disease, you're more at risk, which means that you're somebody that needs to know your A1C if you're diabetic. You need to make sure your blood pressures are well controlled and check your own blood pressures daily. So there's a lot that you can do to advocate for yourselves. Besides getting those laboratories, just making sure you're in control of your blood pressure, your blood sugar, and getting as close to your ideal body weight as possible.
Okay, and so if a family member, because you're talking about family history with actual kidney disease, but what if a family member has hypertension or diabetes? Would that make someone be concerned that that's something that they can be genetically predisposed to, or?
Definitely.
Okay.
Definitely. If you have a family member with diabetes, and sadly, I've dialyzed mothers, fathers, and their children,
Wow.
their adult children, all with diabetes. And there's something, we're not completely certain, but you've heard the term bad diabetics. There's some people with diabetes that go on to experience all of the end organ complications. Besides kidneys that we've spoken about, they have cardiovascular problems like stroke, blindness, and also vascular disease where they end up losing toes, fingers, legs, things like that.
Okay. And can you tell us what a patient can do to keep up with their lab results and their diagnosis?
It's so important when you go to the doctor annually. I tell people sometimes you'll get a piece of paper, keep it in a folder. Sometimes now it'll come on your phone, the so-called My Chart. And, I find a lot of people sometimes have trouble looking it up. If you're good at that, good for you. But some people are not. So you might want to get an old-fashioned paper copy. I had a patient and I stole the idea from her where I had a different color folder for each member of the family. So anything medical, any laboratories would go into that folder. So for instance, if you move, you change doctors, something comes up, you can pull that folder out and look. Last year I had a young man who was on his way to college. He was going to be a varsity athlete. There were some things that showed up. The mom was able to show me his labs from, his late middle school years and early teen years. So it's important to keep track of all of that.
Okay, good. And then I just want to also talk to anyone that is listening that is a patient of DNA. My chart that Dr. McDonald talked about, it's so informative and helpful. It's simple to log in. So make sure that if you do have an appointment, that you get that login information set up so that you can stay on top of your own diagnosis and staging.
And someone in the office can help you if you're having problems with that.
Yes, for sure. So we're going to wrap up, but I wanted to ask you, is there two key points that you just wanted to drive home one more time, even if we've repeated them, whether it's the creatinine test? Is there something that you want to touch on before we wrap up?
Yeah, I think again, I'm going to just emphasize you've got to know your laboratories. You've got to say, hey, why is the normal 1 and I'm 1.2? Why does it say my eGFR is 50 when it should be 100? That's kind of like common sense if you just look at that. And if your doctor doesn't seem very motivated by your question, like I tell people, find another doctor. And you can look it up on Google, but like I say, Dr. Google didn't go to medical school.
Mm-hmm.
So make sure you find out what's going on. It's so important for your health. And if you are diagnosed with hypertension, diabetes, lupus, anything, don't be in denial. It's so much better if you educate yourself about it, you accept it, because when you do, then you can do 1,000 things to help prevent it from getting worse.
Thank you for providing a comprehensive summary of the typical tests that patients with kidney disease may undergo as part of their healthcare treatment. Consult with your healthcare physician for further information on specific tests that are recommended by your doctors.
Thank you.
Thank you for joining us today. For information about Dallas Nephrology Associates, please visit our website at dneph.com. If you found our information helpful, feel free to share it with others who may also be affected by chronic kidney disease.
Dallas Nephrology Associates' DNA podcast series, Let's Talk About Kidneys, is provided for general information purposes only and does not replace the need to talk with a healthcare professional about your unique situation, care, and options. Our goal is to provide you with as much information as possible so you can be as informed as possible. Reference to any specific product, service, entity, or organization does not constitute an endorsement or recommendation by DNA. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity or organization they represent. The views and opinions expressed by DNA employees, contractors, or guests are their own and do not necessarily reflect the views of DNA or any of its representatives. Some of the resources identified in the podcast are links to other websites. These other websites may have differing privacy policies from those of DNA. Please be aware that the internet sites available through these links and the material that you may find there are not under the control of DNA. DNA shall have no responsibility for the accuracy, legality, or content of the external site or subsequent links. Contact the external site for answers to questions regarding its content. The resources included or referenced in the podcast and on the website are provided simply as a service. DNA does not recommend, approve, or endorse any of the content on the linked sites. The content provided on this website and in the podcast is not medical advice and should not be used to evaluate, diagnose, treat, or correct any medical condition. The content is solely intended to educate users regarding chronic kidney disease, end-stage renal disease, ESRD, end-stage kidney disease, ESKD, and related conditions, and ESRD, ESKD treatment options. None of the information provided on this website or referenced in the podcast is substitute for contacting a healthcare professional.